Yoga and its uses for depression.
What is yoga? Yoga is a spiritual practice that aims to balance one's body and mind. It is defined as an art and science of healthy living. Another goal of yoga is to harmonize oneself with the universe and achieve self actualization. History of yoga. Yoga originated in northern India over 5,000 years ago. One of the original yogis, known as an Adiyogi, created the 7 stages of yoga called the Saptarishis. The classical period of yoga ranged from 500 BC to 800 AD, and it was influenced by the Indian religious teachers Buddha and Mahavir. The post-classical period ranged from 800 AD to 1700 AD, and its main focus was on the popularization of Hatha Yoga, which focuses on poses and breathing cycles that help to prepare the body and mind for deep meditation. The modern period of yoga, from 1700 AD to 1900 AD, saw the development of Raja Yoga, which focuses on self-discipline. The contemporary period, from 1900 AD all the way to today, focuses on spreading yoga across the world and maintenance and promotion of health.
Traditional uses of yoga. Yoga started as a part of Hinduism, Buddhism, and Jainism. Yoga is mostly spiritual practices involving core values from the religions. These include analyzing oneself and using meditation to solve the problem, liberating oneself from suffering, and reaching self-actualization and transcendence. Throughout time, different types of yoga emerged. For example, Hatha Yoga, which is most similar to today's yoga, combines yoga poses, breathing, and meditation to connect one's mind and body. Yoga was used traditionally to connect the mind and body and reach self-actualization or transcendence and alleviate one's suffering. It was also used to cultivate discernment, awareness, self-regulation, and higher consciousness in the individual. How to prepare, support, and educate a patient with depression on yoga. First, you want to establish a set regime and schedule for the patient and have the patient perform 2 to 3 90-minute classes per week for 12 weeks. Then you want to assess the patient support system and educate the family and friends on the benefits of yoga, and also encourage the family and friends to attend the classes with the patient to promote compliance. We should also educate the patient on the benefits of yoga for their depression and provide pamphlets and handouts. Lastly, provide a list of gyms and studios that are cost-effective and accessible to the patient. Types of yoga popular in the United States. This includes Iyengar, which comes from Hatha Yoga. Iyengar yoga uses different props, like the yoga block, to achieve the right form and posture for each pose. Iyengar was invented in the 1930s and 1950s, and it's newer and more innovative. The next is Hatha Yoga. This is a more traditional form of yoga used back in the 15th century. Hatha Yoga focuses on its poses, breathing, and meditation. Finally, Bikram Yoga, also known as Hot Yoga, branched from Hatha Yoga, and it uses the same 26 poses and 2 breathing techniques during each 90-minute class. This type of yoga was invented in the 1970s.
Yoga myths versus truths. Yoga is just about stretching. There are many different types of yoga that focus on different aspects that include the mind, body, spirit, breath, and environment. Another myth is yoga is only for women. Yoga was traditionally practiced exclusively to men in ancient India. When it arrived in the West, yoga drew a large female following. Another myth is you have to be flexible. You can practice yoga without having the flexibility skill. In fact, yoga can improve flexibility, strength, and balance as well. A lot of people think that yoga is a religion. Yoga follows the roots of Hinduism. However, in India, yoga is thought of as a science of self-actualization.
The goal of yoga is to awaken and embrace your inner potential and not about worship. Next is yoga is too easy. Yoga practice requires an individual's full attention to be present and engage with every movement. It can be more challenging for people to unify their mind, body, emotions, senses, focus, breathing, and environment. Lastly, yoga is too hard. Many people fear yoga because their bodies don't bend that way. However, yoga practices and teaches you how to listen to your body's signals of comfort, discomfort, and what positions or poses fit you that day. Potential harmful effects. Some health problems can occur if yoga forms are practiced incorrectly. Some examples are back pain or slip disc, ankle sprains, stiff neck or neck pain, muscle pulls or soreness, chronic pain, decrease in quality of sleep. Yoga injuries develop over time because of poor yoga techniques and form. It is important to learn poses correctly from your teacher and to modify your pose if you experience pain or discomfort. When practicing yoga, it is important to use your core when moving through poses to prevent your spine from moving in ways that might compromise spine stability.
Benefits of yoga and depression. Yoga is a physical exercise that includes special body poses, respiration techniques, and meditation. When we meditate and perform yoga, our mind tends to relax and there will be a lower risk for depression. Studies show that yoga reduces the impact of stress, helps with anxiety and depression, is a self-soothing technique similar to meditation, relaxation, and exercise, and also improves energy. Disadvantages to yoga. There aren't many disadvantages of yoga compared to other exercises. Some of the risks include untrained instructors, because there isn't a universal yoga credential system. Studios are responsible for hiring practices. Another disadvantage is high heat. Yoga such as Bikram yoga puts students in hot and humid rooms above 100 Fahrenheit, and that could lead to dehydration. Finally, another disadvantage of yoga is injury. Even though yoga helps with helping in improving injuries, it can cause an injury if done incorrectly, since it consists of lots of twisting and bending.
So, when discussing with healthcare professionals on benefits and cultural competency of yoga, teach healthcare professionals how to incorporate yoga into a patient's care plan. Also, people use yoga to help themselves with a multitude of problems ranging from mental health disparities, ortho issues, and substance abuse recovery. And people of certain cultures view yoga as a culture in and of itself. Buddhists practice yoga and meditation to help them along the path of enlightenment and achieve absolute oneness of being. Yoga is also taught in one of the 6 schools of thought in Hindu philosophy used to experience altered states of consciousness to bring insights about self and the world. Also, in more modern times, people who don't necessarily identify with a religion use yoga to practice spirituality as they define it. So, when discussing a plan for intervention to the healthcare professional, and you're devising a plan to use yoga in a patient's healthcare plan, you should give them names and locations of yoga studios that are accessible to them near where they live. You can refer them to literature that can teach them more about yoga and its benefits, maybe specifically for the condition that they're experiencing. And you can also educate them on how yoga can help people suffering from depression, since we're focusing on depression. Some ways to evaluate the efficacy of the healthcare plan that you've provided to your patient is create follow-up appointments with the patient, and during these follow-up appointments, perform mental status exams on them to track their progress to see if yoga is actually helping their depression. So you want to evaluate like their overall mood, their thought content, their general outlook on life, and if they've started to develop any long or short-term goals.
Thank you for listening to our presentation, and please use our references for more information on yoga.